Hello all, my name is Brian Smith, and today we'll be discussing systemic racism and electronic medication health records. This analysis will describe the correlation between the implicit bias of clinicians and the misuse of health technology, along with recommendations to improve EMAR. We'll be working towards the elimination of institutional and structural racism as relates to health technology within the U.S. healthcare system. Within our executive summary, we see that health technology has amplified in use within healthcare systems and institutions. Due to the increase in incentives and board regulations, more health organizations are opting to adopt health IT software. Health IT, specifically electronic medication administration records, can create better patient outcomes. However, because of an array of circumstances, the adoption of this technology can cause more problems than solutions, especially in communities of color. It is evident that systemic racism is webbed throughout the U.S. history and has continued to present itself in many facets of our current times, even within our healthcare and how we treat patients. Having a combination of inappropriate and inadequate use of health technology and institutional racism can be very detrimental to individuals of color and lead to an increase in mistreatment and negative health outcomes to this population. When used appropriately, health technology has the ability to mitigate health disparities through the standardization of care. Clinicians have the ability to impose their implicit bias on the treatment plan of a patient. To avoid the frequency of implicit bias, it is essential to alter the way clinicians practice and incorporate proper use of health technology. Recommendations to improve usability of EMAR are as follows. Healthcare professionals having to attend comprehensive trainings and extended education on diversity in healthcare and the EMR platform. Healthcare institutions having functional software with user-friendly interfaces and usability training of software. And lastly, healthcare is having stringent accountability measures on healthcare systems usability of the EMAR platform and data mining to obtain meaningful knowledge. So what is electronic medication administration records? Electronic medication administration records, also known as EMAR, commonly referred to as a virtual drug chart, is the report that serves as a lawful record of the drug administration to a patient at a facility by a healthcare professional. The EMAR is a part of a patient's permanent record on their medical chart. Within the mental health system, the advancement of health technology is vital to their vision of improving healthcare for all patients in order to have the best patient outcome. In medicine, there is a long history of patients of color facing barriers to access care and receiving less effective health care. Studies have found that Black patients are less likely to receive pain treatment, potentially life-saving lung cancer surgery, or cholesterol-lowering drugs compared to white patients. Such disparities probably have complicated roots, including explicit racism, access problems, lack of insurance, mistrust of the medical system, cultural misunderstanding, or unconscious bias that doctors may have and they're not even aware of it. Now let's discuss how EMAR may have usability errors. Using this form of health technology can present errors, whether it may be human factors or usability errors. It's stated that distractions, interruptions, and human influence could affect patients' ability to focus on the entrance of medication information. This same piece explains that 35.4% of medication errors are due to workplace distractions. These errors can directly impact patient care, as all health technology roles and impacts do. When clinicians use an interface that is not user-friendly, it decreases efficiency and clinicians' productivity, which may compromise patient outcomes. So now let's discuss systemic racism. Racism and the effects of racism continues to be ingrained in the psyche and subconscious of U.S. citizens. According to sociologists, from the 1600s, the oppression of Americans of color have been systemic and rationalized using white racial framing, with its constituents, racist stereotypes, ideology, images, narratives, and emotions. The U.S. is a country with systemic oppression, centuries of genocide, 336 years of slavery and legal segregation, about 85% of U.S. history. Since the 17th century, a white elite has played the central role in maintaining rationalized institutions and in rationalizing white framing, while ordinary whites have usually supported oppression because of white privilege. Systemic racism includes the policies and practices entrenched in established institutions, which results in the exclusion or promotion of designated groups. It differs from overt discrimination in that no individual intent is necessary. So let's discuss racism within healthcare. History and research has depicted a crucial U.S. public health problem involving systemic racism and its adverse effects on minds and bodies in all racial groups, more especially underserved Americans of color. Systemic racism theory is firmly grounded in the racial critical literature created since the 1960s Black civil rights movement. It was the first articulate way for healthcare systems to understand the problems within the healthcare system. Today, unjustly inherited white resources and continuing discrimination restriction access of many Americans of color to better jobs, quality education, healthy neighborhoods, quality healthcare, and political power. Numerous health disparities plague communities of color, causing a disproportionate advantage for white Americans to receive optimal healthcare. Evidence demonstrates that African Americans, Latinos, Native Americans, and Asian Americans receive a more reduced quality of healthcare. When comparing physicians whose clientele is more than 50% patients of color to physicians who serve less than 50%, the former is less likely to offer particular screening, vaccinations. Also, in emergency rooms, Black patients are less likely to receive pain management treatment. One review study shows and examines medical article on pain and found patients of color were more likely to have their pain taken too lightly and less likely to have it medically recorded accurately than white patients. In most studies, patients of color were less likely than whites to get the best quality pain management. So what is the correlation of health technology and social systemic racism? The purpose of EMAR should be designed to support clinicians' workflow process to ensure efficiency and effectiveness, especially compared to traditional paper-based medication administration records. If the usability of EMAR platform is inefficient and institutional racism is still plaguing the health systems, healthcare outcomes for communities of color are in jeopardy. Yes, healthcare technology can improve healthcare outcomes if meaningful use is met. However, if health systems are not adopting the technology correctly, communities will be affected by systemic racism and inadequate health technology usage. It is incumbent upon health systems to properly adopt health IT to better standardize care and mitigate systemic racism. So here before you we have recommendations. Strategies that should be adopted in order to maximize and improve usability of EMAR consist of ongoing comprehensive training and education for all users, functioning software for user-friendly interfaces, and usability training of software, and more stringent accountability measures on health systems usability and data mining to obtain meaningful knowledge. Having these strategies in place will potentially increase patient outcomes of all patients through the standardization of care and through proper usability of the usability of the EMR platform system. So here you can see more clearly the strategic plan that we have set in place. We have 3 phases. We also have the description of the phases, challenges, and solutions to those challenges. So in phase 1, we have comprehensive training and education for all users. A challenge that you may see or we may see within this implementation would be requires clinicians who may be already overworked to dedicate time for more extensive training and education. A solution would be incentives for those clinicians participating in training, for example, additional PTO, overtime pay, and CME credit. In phase 2, we have functioning software with user-friendly interfaces and usability training of software. And a challenge would be software of this caliber can be expensive, and finding the platform that meets the needs of most clinicians will be challenging. For solution, it could be beneficial for smaller health institutions to apply for grants and aids that assist in the expenses of this purchase, which is vital to the healthcare system. And in phase 3, we have stringent accountability measures of health systems usability and data mining, obtaining meaningful knowledge. A challenge can be finding methods and experts to manage the accountability of this meaningful use. And a solution would be to hire on or promote present associates to keep other staff members accountable of meaningful use. Also, most signs we can post signs of clear and simple instructions of EMAR usage. So having signage up can definitely assist with the recognizing of what is supposed to be done for proper usage and usability of the EMAR health system. So let's take some time to analyze our strategic plan. So the strategic plan allows for the meaningful and proper use of EMAR platforms to provide more standardized care to all patients, no matter the color of their skin, ethnicity, sexuality, or gender. The benefits of this plan consist of equal patient care and treatment, optimal health outcomes of patients, adequate understanding of platforms, and user-friendly platforms. Some limitations that may arise are proper funding for these changes and sufficient compliance of stakeholders to implement these recommendations. There are leading healthcare stakeholders that still believe systemic racism is not present within healthcare, which can be problematic in advancing the strategic plan and may be more reluctant in not investing in this plan. Cost can be one of the biggest barriers for implementing and sustaining health IT. An investment in EMAR is one that a healthcare system will be making continuously because of the continuing education that is necessary for seasoned and new clinicians, and also because technology is consistently evolving. The IT that is used will have to be updated, which is additional cost for the health organization. The cost of the strategic plan can be seen as an expensive investment and may be questioned amongst the leadership of the healthcare system if it is a viable purchase and investment. So to conclude, this analysis emphasizes how imperative it is for health systems to invest in usability of their EMAR and other forms of health technology. If health systems enable inappropriate usage, they are in turn complicit to the health disparities that exist in communities of color. It is incumbent upon health systems to use the recommendations provided to foster standardized care and treatment for the betterment of all patients and the fall of health disparities in the U.S. healthcare institution. Thank you so much for your time.